And so that's the reason why tests are developed and redeveloped and have revisions all the time. And I'm glad to say that many of our tests have just gone through, many of the very popular tests that people use in neuropsych have gone through revisions very recently, and they have had much more diversity within their norms.
What is up, fam? Welcome back to the channel. My name is Phil Sarpon. This is Phil's Guide to PsyD. This channel is dedicated to all things psychology, wellness, and graduate school. Today we have a very special guest with us. Her name is Dr. Courtney Ray. She is a clinical neuropsychologist as well as an ordained minister. And so I'm super excited to get into this conversation with her today. Along with being a neuropsychologist, she's also a neuroscience researcher, a writer, a professor, and she's the founder of Array Psychological Assessments, which is a private practice that provides neuropsychological evaluations in Northern New Jersey and New York City. She's the current president of the Society for Black Neuropsychology, as well as a member of the American Psychological Association, the International Psychological Society, and the Society for Neuroscience. She earned her Ph.D. in Neuroscience and Neuropsychology from Loma Linda University and her Masters of Divinity from Andrews University. She's also the author of the upcoming book, Just Pray More and Other Church Myths About Mental Health. So I'm super excited to jump into this conversation. We talk about neuropsychology, we talk about spirituality, we talk about mentorship, and a lot of other different things. And so without further ado, let's just jump right into it. Hey, Dr. Ray, how are you doing?
I'm doing all right. I'm doing all right.
Thank you so much for being here. I know me and my audience really appreciates it. And it's really cool having a neuropsychologist that we get to talk with and just learn about. So thank you for the time.
You are welcome. It's my pleasure.
Well, let's see if we can just jump right in. I'd love to know what got you into psychology and what made you want to become a neuropsychologist.
Okay, well, those are two separate questions. So psychology itself is something that I always had sort of an interest in, even when I was in undergrad. And psychology, this is actually my second career. So my first career is being a minister. And so I was pastoring in different congregations. I pastored in Michigan and in Maryland and in California. And it was when I was in California that I had a lot of people who would come for counseling. And when I was in seminary, which is graduate school for pastoral ministry, um, I was learning all I could about pastoral counseling. But as I saw more and more people in the congregation and also in the community who would come to the church, a lot of people had other issues that were beyond my skill set and competency. And so I would refer them out, because I would say, well, I think that, what I can do and how I can help you is not going to be sufficient for what you really need. And so I would try to give people referrals to different mental health professionals in the community. And a lot of people wouldn't go. That's one thing that I noticed. A lot of individuals in different faith communities and a lot of people in a lot of minoritized communities, especially Black communities, don't really have a desire to go and seek mental health, professional help. And that's changing. It's becoming much more acceptable. The stigma is lessening a lot. So I am thankful for that and grateful for that. But particularly at the time when I first started, a lot of people were very, very resistant. And particularly from the faith aspect, there was this idea of, if I go to somebody who isn't necessarily of my own faith, are they going to disparage me? Are they going to look at everything from a secular perspective? Are they going to really respect my beliefs? Is it unfaithful for me to go to someone who's not a Christian and talk to them about my problems when I should just be able to pray and that should be it, that kind of a thing. And so it wasn't going to work with me just sending people to different places. And so I figured, well, if I can't do that, then I can become the person who people can come and talk to. And so I decided to go get my PhD in psychology. And so that was that, doing my doctorate, specifically for being able to minister to the community of faith and also the Black community around me. Because even if somebody wasn't necessarily of a particular faith, people felt much more of an affinity to come to talk to me, even if they were like in the community and stuff. Then going, there's like a lot of distrust, and there's a lot of historical reasons for that, why a lot of people in minoritized communities are kind of wary of going out to different professionals who are part of the health field and stuff like that. So I did my studies at Loma Linda University, and while I was there, that's actually the first time I ever heard of neuropsychology. Never heard of it before that. I had never understood what a neuropsychologist was. Um, so I learned that what they did was look at both the psychological and emotional part of it, and also your function and cognition and the brain behavior aspect. So being able to combine both the biological sorts of factors with the emotional parts really was something that resonated with me, because I've always loved science. I was a biology major originally when I was in undergrad, and so I've always been a very had a high affinity for science and stuff like that. And so being able to see that, oh, this is a field of psychology that kind of merges these two worlds was really, really exciting for me. And so that's kind of how I wound up doing that. That's a very long answer to a short question, but I mean, it was a convoluted journey to get there.
Oh my gosh, no, that's incredible. I I really resonate with that story because I myself, psychology is not my first career. I was actually doing more of the medical field things before I got into psychology. But I think it's fascinating how, for you being a minister, you were able to see sort of this duality of all of these mental health problems, but also you were in this spiritual context. And I think for me, like, just even personally for me, growing up in a predominantly Black church, I definitely also saw that. I saw people not doing this on purpose, but kind of over spiritualizing sometimes when it came to mental health problems. And and like you said, I think there is a little bit. I think maybe social media has a lot to do with it, but it does seem like the stigma is decreasing. But there is still a lot of work to be done, especially in sort of the partnership, or sort of the ways that the church and mental health professionals can kind of work together. And so I love that. I love the fact that that was your first kind of real exposure to mental health, and that inspired you to want to go into it. And now you get to help people kind of in both ways. What does your day to day look like now as a neuropsychologist? What population are you seeing? What type of conditions do you see on a consistent basis?
So I do lifespan. So there are some neuropsychologists who do just pediatrics, or they just do geriatrics, or they do traumatic brain injury. But for me, I do lifespan. So I see a little bit of everybody. But I noticed that most of the people who are my patients are usually people from the ends of the age spectrum. So I get a lot of parents who are concerned about their children and are concerned about their academic work. They may have had a psychoeducational evaluation in their schools, but maybe things aren't really helping, or they felt that it wasn't thorough. And I get a lot of Black parents specifically who might feel like there might be a disconnect between some of the professionals that they've seen before and their kids being able to like express themselves. And so sometimes they feel like having someone who has the same background will be very helpful to learn, to know exactly what's going on with their kid, and to kind of draw that out from them as I'm doing these assessments. And there are things that are cultural that do affect our just our cognition, our perspectives, our way of life, our mental health. And I also see that on the opposite side of the spectrum. So I see a lot of parents who are brought by their children. And so when we have a lot of older individuals who will come and they will be brought by their kids, their adult kids, and they're like, there are lots of things that I think people might miss and might not recognize are some things that are cultural too that can feed into some of these issues that we see. For example, I have noticed that many people are not taught in our communities that high blood pressure and diabetes is something that is very prevalent in our communities. And a lot of people aren't taught that there is a connection between those and dementia and cognitive issues. And so people who are like, oh yeah, I've been on diabetes medication or high blood pressure medication for all this time. And, but it's not really a big deal. I don't see how that connects. And it's like, yes, it does connect. And I feel like sometimes some practitioners, not all, but some practitioners of other cultures might not ask the questions that I might know to ask because I'm like, I know that this is something that's a common thread. And so I'm going to ask these questions. And it's not necessarily that anybody is trying to necessarily be malicious or anything like that, but cultural competence is a really important part of psychology in general and in neuropsychology specifically. And I know that a lot of people don't really recognize that. They feel like, oh, a brain is a brain is a brain. It doesn't matter. And so culture has no impact on that. And that's not true. Culture permeates all of the different aspects of our lives, including our cognition and wellness. So, yeah.
Yeah. Yeah. It made me think of there's kind of like these two issues where for me, I didn't really know about neuropsychology until like a year before applying to grad school. And then there's sort of like this, from a minority standpoint of the small percentage of people of color that are neuropsychologists.
Mm-hmm.
And then the other issue of like, even for patients, right? Going to a neuropsychologist for help is that, being able to educate that certain communities about the need for neuropsychology, but also trying to find culturally competent neuropsychologists as well. How do you kind of deal with those two different issues? So the percentage of neuropsychologists being so few in terms of people of color, and then also spreading awareness and education for Black and minority communities.
So glad you asked that. I'm the president of the Society for Black Neuropsychology, and those are basically our twin goals. We also have a goal of research and making sure that underrepresented populations are also being considered when we're looking at different research questions and things like that. But the two things that we have done heavily have been about increasing the pipeline of individuals who are coming into the profession. And so trying to encourage more Black people to become part of the neuropsychology field. And then also doing that outreach and trying to get people to know what neuropsychology is. I mean, listen, I was in grad school before I learned about what a neuropsychologist is. And so people who are in our community who don't necessarily have an academic sort of connection to psychology, where would they know about neuropsychology, right? Unless somebody's actively telling them. And so we do a lot of different kind of outreach things. We have a website and a YouTube channel where we try to do sort of educational things for the community. We've done Q&As, just some basic brain health kinds of things. And in my own private practice as well, I try to do that. I don't upload as much as I should. I know I need to be better at that, but I try to think about, well, what are some questions or connections that people might be interested in hearing about? And so just trying to get that out in as many different platforms as we can. But it's difficult, right? Because, just trying to do a lot of outreach, much of it because of COVID has been online and virtual kinds of activities. But now that a lot of restrictions are lifting, SBN really wants to get more involved in the community outreach in person. So hopefully in the future, in the next few months and even beyond that, we'll be doing a lot more in-person things in addition to virtual kinds of things. But you are absolutely right that that knowledge base for students who are coming into the field of psychology, being aware of neuropsychology specifically, that's something that we try to do. We try to concentrate on. So we have a symposium that we do annually for undergrads and people who are grad trainees, but are maybe they don't already know about neuropsych, but maybe they have an interest in neuropsych, and getting them connected with people who are already in the field and who do know about it and who want to be a part of mentorship. So we have a mentorship program also. We have a lot of scholarships that we give to different young people. So we're trying to get that momentum going where people hear about neuropsych and they're excited about it and they want to be a part of it. I've done things for like elementary schools and career days and all these kinds of things to try to raise awareness as early as possible. Not everybody that I reach is going to be a neuropsychologist when they grow up, but hopefully there's some kids who are like, oh, I like that. I think I want to do that when I get older.
Oh man, that is so cool. I love that you shared a plug about that, about being the president of the Society for Black Neuropsychology, as well as your YouTube channel, which I think is a great resource for students. And we'll make sure to put down some links for people to check that out. But yeah, I think that's so important in terms of raising awareness and education for incoming students, even if they're in high school or even in college, just so that they're aware of it. And then at the same time, that way, when they go out into their communities, they can also share the word that they are, neuropsychologists in training, and kind of get that awareness in the community as well. I'd love to go back to the sort of the neuropsychology testing part. I know there's a long history, of course, of how neuropsychology testing and assessment came to be. And in terms of the ways that it's culturally relevant or culturally sensitive to different populations, a lot of these norms have not been normed on Black people. They've been normed on, white Americans. And so what is kind of the way that you approach that in terms of neuropsychology testing? And then in addition to that, do you think that there's a possibility where over time that we can have just more diverse neuropsychology testing for people of color?
Absolutely. Those are great questions. So, yeah, there has been historical bias that has been permeating all of medicine, all of health, including mental health and including neuropsych, right? And so we're looking at tests specifically that we use to assess. There has historically been, as you said, a lot of tests that have been made that just look at white populations. And that's part of the whole research thing, right? The idea that we have to have a sample that is diverse in order to be able to apply these tests in a way that is valid for different populations. And so, one thing is encouraging people who are in the community to take part in these norming tests. Like, because, okay, so we're talking about historical different impacts. And so, of course, a lot of times when people think about testing, they think about, oh, the Tuskegee experiments. Like I hear that all the time. Anytime I try to recruit people from the community to do testing, that's the first thing that comes to their mind. But neuropsychological testing, as your audience knows, is not invasive. It's nothing like that. This is just, we're doing lots of paper pencil tests. There might be some physical manipulation of different objects, different things like that. But, nobody's like pumping you full of any kind of chemicals or anything like that. That's not the kind of test that we do when we're testing norms, right? So we're looking at what are the ways that if I'm giving this oral reading test, are these words that people are familiar with, or are these very obscure, or are they much more likely to be just seen in certain populations? There is a very famous test that I won't say the name of that was developed in New England. And in this test, you're shown different pictures, and you're supposed to tell the name of a specific thing to try to test your ability to kind of recall your semantic fluency. So basically, your understanding of, okay, can I look at this and draw out this word? Um, but some of these pictures that are in this test, if you did not grow up in New England, there are things that you just will not know what they are. I've, had not to be like, oh, boastful or anything like that, but I think I'm a pretty smart person, and so I remember when I was learning these tests and I'm looking at some of these pictures, I'm like, I don't know what that is. I've never seen that before. We don't have this object in New York City, in the Bronx where I grew up. And so I've never seen this. And so there are lots of things that, you might think, oh, picture naming seems like that's not a biased thing, but it is, because if you're not familiar with a certain thing, then you're not going to be able to draw out the word for it because you've never seen it before. And Dr. Tony Stringer and Dr. Jana Kanga, who have developed the African neuropsych battery, illustrate this very beautifully, because there are pictures that they have had that they've drawn from different cultures in Africa, specifically the Congo and sub-Saharan Africa, things that are very native to those countries there, and brought it to North America to show people who are in neuropsych, like, hey, can you pass this test? Do you know what these things are? And so if you live in North America and you've never seen some of the different things, different objects, different fruits, different things that are very common in many of the sub-Saharan countries, and you're looking at these things and you're like, oh, I don't know what that is. Does that mean that you're less intelligent? No, it just means that you haven't been familiarized with that. You haven't been exposed to that. And so parsing out, how can we look at what is truly neutral versus what has cultural elements to it, is something that test developers always have to be cognizant of. And that's why we need more people to be a part of these tests, so that we can see, hey, you know what? We notice that when we test people who live in, New Mexico, they're not doing as well on this test that we developed in New England. Maybe there's a reason for that, and being able to kind of recognize that there are these biases that even in our best attempts, we need to really be mindful of and cognizant of. And so that's the reason why tests are developed and redeveloped and have revisions all the time. And I'm glad to say that many of our tests have just gone through, many of the very popular tests that people use in neuropsych have gone through revisions very recently, and they have had much more diversity within their norms. And so it's kind of expanding a little bit more. And so I would say to people in the public, if you have an opportunity to be a part of these tests and norming, don't be afraid. Come and be a part of that research. When we do different research, calls for people, come and do that. And then also, hold neuropsychologists and test developers accountable as we continue to do these tests and make these tests. We're trying to get those diverse populations. In those things that we've seen, that we can determine that there's definite biases in populations, there have been different norms that have been developed for different populations. So there are demographically adjusted norms. So they look at different groups and say, well, we know that this group performs differently than this group on this test. And so because of that, we have these adjusted norms that you can use. And so sometimes, depending on what the test is, depending on who the patient is, I might use a demographically adjusted norm. And so those are ways around that as well. And being able to have a neuropsychologist who's confident enough to understand when a adjusted norm is appropriate versus when it's not appropriate is really important. So, even if you think that, oh, neuropsych is very objective, these kinds of things are really important to know, for somebody to be able to apply them effectively. So,
Mm.
yeah.
That is so good. I think the cultural humility, the cultural sensitivity, the awareness. I was born in Ghana, and I've been really interested in uh, when I do visit Africa again, like just trying to explore that world of even how they were able to norm their test and kind of seeing the differences. I think it's so cool that neuropsychology isn't this like broad thing that you can just throw out, and there has to be some intentionality behind the way that you create the test and who the test is for. And I feel like for a lot of even minorities, if we're not at the table, even trying to create the test and develop the test, then we're gonna miss we're gonna miss out on. And so it's twofold, like you said, of being at the table, but also having the bravery and the courage to also not be afraid of the research, and to also be able to understand the research. And so I love the way that you were able to tie that together, because I think those two things are so important. I'd love to know a little bit about, just in general, what you love about the field and what you're doing. I feel like there's so much intersectionality in what you're doing with the spirituality and the neuropsychology, but what's one thing that you love about what you're doing? And then also, what's one thing that is kind of challenging?
So I think that one of the things that I love just on a practice day to day is being able to interact with different people and being able to give help to people who I know probably wouldn't be able to get help otherwise. So I do sliding scale sometimes for different clients, and I do a lot of pro bono work as well for Physicians for Human Rights, who specifically help people who are refugees and asylum seekers, and giving neuropsychological batteries for them so that they're able to have justification for their asylum. And so we look and try to find out, like, if they have different issues that would justify them remaining in the country. And so being able to help is kind of that's sort of the theme of what I like to do is helping people. The most challenging thing, I think, is just the frustration of trying to get the word out and trying to explain to people and help people understand, like, hey, this field is for you. We have these tools available for you. This is something that you and your family can benefit from. And so that's kind of frustrating, is not really being able to gain that traction, because a lot of people aren't necessarily enthusiastic about any kind of doctors going to any kind of doctors. And so, like, try to get people excited, like, hey, this is something that you should do in addition to going to the dentist and going to the physician. You should also get a neuropsych baseline for yourself. That's not necessarily something that people are gung-ho about. So, that convincing kind of pulling, it's a little bit frustrating to try, but it's rewarding when you're able to make inroads into communities and help communities know that you are there to help and that you are available. So, yeah.
That's awesome. I feel like neuropsychology it can be such a vital piece of people's preventative care
Mm-hmm.
in so many different ways. Just getting a baseline of where you're at, mentally, psychologically, and so it's one of those things where I was able. My last practicum site was at a neuropsychology private practice, and they interacted with a lot of medical professionals, and I think that was cool to see sort of the integrated care of doctors also pushing their patients to get testing done, and so sort of a collaboration effort there, and so I thought that was really really cool, and I hopefully that could be something that's just more common, where people say, hey, when I go to the doctor's office, I'm just also going to go see my neuropsychologist too, and just kind of make it more of a normalized piece of healthcare. So
Mm-hmm.
one last question before we end. I'd love to know a little bit about what you do in terms of just wellness for self care. this field, I think, is we get to help so many people and invest in so many people's emotional, mental health. But what do you do for yourself and taking care of yourself?
Yeah, so I am very much a sociable person. So I spend time with my family, spend time with my friends. I disconnect every week for my own faith. Part of one of the things that we practice is having a Sabbath. So that day, there's no work. We're all totally disconnected on Saturday. And so that is pretty rejuvenating for me, being able to just spend some time doing some of the things that I think are creative pursuits, like writing. That's one of the things that I just love to do. Even not the report writing, that is the tedious part, but just like creative writing, that's something that is expressive for me and I love to do. So, those are things that I do to kind of recharge myself, because it can be emotionally draining, and even though it's not therapy, we still take on a lot of the type of emotional burdens with our patients, getting them through different things. So it is so important to be able to do that self-care, and sometimes we don't emphasize that enough.
Oh my gosh. Yeah, absolutely. I think it's just great to hear other clinicians talk about self care. I think it's something that's so important, so needed. And so overall, Dr. Ray, I really appreciate your time just being here, sharing with us about neuropsychology and what you do and the intersectionality between, spirituality and mental health. I think it's just so vital in our community. And so I really appreciate the work that you do and for the time that you've been here today.
Well, thank you so much for having me, Philip. I really do appreciate being able to come to share with your audience.